Hi everyone, welcome to our motivational interviewing training. We're so happy that you're here today to learn more about this process of working with young people to help them to think more about their decisions and how they are coming to different decisions about behaviors. I want to tell you a little bit more about the Center for Healthy Youth Development. So the Center for Healthy Youth Development used to be called the Healthy Youth Development Prevention Research Center. We rebranded in 2024 following the conclusion of CDC funding. And our center is located in the Division of General Pediatrics and Adolescent Health, and we're still part of the Department of Pediatrics at the University of Minnesota Medical School. So you can still find us in all the places that you found us before. On the bottom of the screen in front of you, you'll see places to join our newsletter, to sign up for events and news and different things that we have going on. So please go ahead and sign up at that link so that you can be part of all of the information that we are going to be sharing with you about all the things related to the work that we do at the Center for Healthy Youth Development. We are your trainers. We're so happy to be with you today. I'll introduce myself and then let Caitlin say hey to you as well. So I'm Jill Ferris. I use she, her pronouns. I am the Director of Training and Education at the Center for Healthy Youth Development, as I was just discussing. My background and kind of work in this field, I've worked in the field of adolescent sexual and reproductive health for a couple of decades. I have a background in public health with a master's degree in maternal and child health. And I have been working in kind of the motivational interviewing space and kind of providing support and TA to folks around motivational interviewing for a pretty long time, about 15 years. So I have a lot of expertise in helping folks kind of get to the nitty gritty in terms of what it means to do motivational interviewing with young people. And so really excited to share all of that information with you today so that you can take it and use it in whatever way makes sense for your setting. Caitlin, do you want to say hey to folks?
Yes. Hi, everybody. Nice to virtually meet you.
Yep.
My name is Caitlin. I use she, her pronouns as well. I spent 13 years in the sex education field at Planned Parenthood, Minnesota, North Dakota, South Dakota, or North Central states, and am now co-training with Jill, doing lots of presentations across the state and even in other states to people like yourself and other sexual health people in the field, talking about motivational interviewing and all different kinds of similar topics. So excited to be here with you all today and help you get refreshed on this topic.
Excellent. All right. So I'm going to take you into a little bit of the background of kind of what our presentation today is going to cover and kind of the flow so that you can, especially if you're looking at a one specific part of motivational interviewing, if you wanted to forward ahead in the video a little bit or kind of know how this is going to be broken out. So we're going to spend a little bit of time talking about the background and the definitions of MI, but then we're really going to get into sort of what does it mean to do it and what are those elements that are really core to the reasons why motivational interviewing is such a sort of integral part of the practice that we use to change behavior. So we're going to be talking about the spirit of it, sort of the culture and the feeling of motivational interviewing. We're also going to be talking about skills, and the skills hopefully will be really useful for you. Usually the skills are the part that people find to be the thing that they remember the most or the biggest takeaway. We're also going to be talking about the flow and kind of how it all works together. And then we're going to be talking about when the inevitable happens, which is resistance or discord, when we have a young person, a patient maybe who doesn't maybe necessarily see it the way we do or has questions about our approach. We'll talk about how to manage resistance and discord, and then we will close out. So that's our plan for our time with you today. We wanted to start with just a general definition of motivational interviewing. There are lots of definitions of this, but we wanted to give you the definition that comes right from the two people who created it, which are Miller and Rolnick. And so their definition of motivational interviewing is as follows. Motivational interviewing is a collaborative, goal-oriented style of communication with particular attention to the language of change. And it's designed to strengthen personal motivation for and commitment to a specific goal by eliciting and exploring the person's own reasons for change within an atmosphere of acceptance and compassion. Okay, so let's break that down. There's lots of things within that definition that are sort of bolded or highlighted for you. So a couple of really important points. It's collaborative. So this isn't one-sided. It really is sort of a dance, a back and forth, if you will. And the goal is for you as the practitioner to be listening for the language of change. You want to be actually kind of creating the conversation so that the young person that you are working with maybe starts to say things that are in that vein around the language of change. And the way that we want to do that is by hearing from that young person what is important to them and why they might want to change. Sometimes if we come at it from our own perspective or from where our sort of, where our adult brains are, our reasons for them to change might be entirely different than their reasons to change. And so we really want to tap into what is their intrinsic motivation and desire and then go with that rather than sort of making an assumption or putting our assumptions or our best our beliefs about what they should do onto what the situation is. A couple of other really important things I wanted to mention just as general things about motivational interviewing. So it's a guiding style, but it doesn't mean you just sit back and let them totally drive the conversation. It's absolutely, two-sided. It sits between kind of following and directing. So it's very much a balance of good listening and also this like more prescriptive or giving of information or advice. And it's really designed to empower people by thinking of what are their own sort of, capacities and importance. What are the qualities that they have intrinsically already to be able to change? So it's really helping to empower them to say, you actually already have everything you need. I'm just going to help you figure out how to get there. MI is based on being a respectful and curious way of being with people. So it really is, obviously, respect is at its core, but then really a curiosity that we come to it as adults with to help to say, what is important to you? What does matter to you? And that we are intensely curious about the young people that sit in front of us. We facilitate this process of change and we honor their autonomy. It's a really important thing for any age of person, but I think especially young people are not often used to being treated with a whole lot of autonomy. And so when they receive that from us, that can feel really good. MI requires engaging with the client as an equal partner and refraining from unsolicited advice. So this is a great strategy to use when you're doing MI, to just say things like, would it be okay if I shared that with you? Or I have some great information about this. Would it be okay if I, grab this pamphlet or whatever? So we want to refrain from unsolicited advice. And we also want to refrain from confronting and instructing and directing. And it's not a way to get people to change. It's a way to get people to tap into their own internal desires and motivations and use those things to kind of further harness the change that we want them to see and that they want to hopefully see for themselves. So here's our to-do. It's Miller and Rolnick. We have William Miller on the left and Stephen Rolnick on the right. They basically created motivational interviewing back in the 80s as a process to help folks through alcohol dependence and treatment. And so it has grown a ton since the 1980s, and we are using it here in 2025 to think about how we talk about young people and the behaviors that they're doing and how we help them kind of move them towards more healthy behaviors. So these two are, and Rolnick in particular is still involved in the field quite a bit, but you'll see their names all over the motivational interviewing space because they are the two founders of the work. All right. With that, I'm going to let Caitlin take you into the spirit of motivational interviewing.
Awesome. Yeah. Thank you, Jill. So when we're thinking about the spirit of motivational interviewing, we're sort of thinking about what is the overall emotional sort of goal that we're coming with. How are we going to create a relationship with this person to help them create the changes that they really want to make? And so it encompasses these 4 areas: the partnership and collaboration with this young person, evoking what's inside of them to help them sort of create their own path and journey towards this change that they want to create. We're going to come with acceptance of where they're at in that journey and what their realities are, and then we're going to be compassionate as well. So that's sort of like the flavor that we're putting on this conversation with this young person and kind of helping them create some change in their life.
So do you want to just...
Sure.
Do you mind? So you can just hit there. There you go.
Perfect. Awesome. Thank you.
Yep.
So we're going to dive into these 4 areas a little bit more. So partnership and collaboration, as Jill was already alluding to earlier, this is really about collaborating with this young person. So I'm sure we've all been in situations where we've been given some unsolicited advice and maybe it sort of sat uncomfortably with us, and maybe we've even been on the giving side of giving unsolicited advice before. And as we know, that doesn't always go the direction that we're hoping it's going to go, right? So this young person is in front of us, and we know that they want to create some change, or they've given us some reasons to believe that they want to create some change in their life, and we're going to partner with them in order to help them figure out how they can get there themselves, right? Because they got to do it on their own. Nobody can make anybody else change. So it's a partnership as opposed to being sort of paternal towards them, right? So if we were taking a paternalistic approach, we would be the expert in that situation. We would be doing this to them. We would be trying to win them over to our side, and we would be responsible for the direction that this behavior change is going to take. If we're partnering with them, that means that we are working together as equals, right? So even though I'm an adult, I don't know more than this young person does about what their reality is, right? They're the expert in the situation, and I'm going to help them get there. We're doing it together. We're showing interest and support for their story, where they're at, and the changes that they want to make. And we're going to witness the change that they're taking, right? They're in the driver's seat, and we're helping to sort of support them and encourage them in different directions and good directions. And so that was sort of the partnership piece. when we move into the evocation aspect of the spirit of MI, we're really trying to evoke the people within themselves have resources and skills that they need that's going to help them create the changes that they want to create. So this sort of we're evoking their own values, their own priorities, their own wisdom, their own resources, their strengths, their ideas, their solutions, their motivation, right? So we know that they have what they need in their life to make these changes, and we want to give them that autonomy to do that and support them by sort of drawing out all these different things and being like, wow, you have a lot of experience with this already, or you have all these resources in your life, or I can tell that you're really motivated to make these changes. So this is the evocation piece. Acceptance. We accept that this young person has autonomy, that they have absolute worth. We're going to affirm them along the way, and we're going to be empathetic while we do it. So the MI practitioner takes a non-judgmental stance, seeks to understand the person's perspectives and experiences, expresses empathy, highlights strengths, and respects a person's right to make informed choices about changing or not changing. And that's sort of a reality that we have to accept as well, right? It's possible that this young person, because they're an entire human being, just like us, might decide, you know what, actually, I don't want to make this change, or I'm not ready to. And we are going to accept them where they're at, right? So we know that they are autonomous, and we're going to be empathetic and affirmative towards whatever they're deciding to do there. And last of all, we are going to be compassionate. So if we are, trying to create a trusting relationship with this young person, and really this spirit of MI is really important because it's sort of going to lay a foundation for the rest of the process. We want to have a trusting relationship with them. If this young person doesn't trust us, if we're not able to create this sort of relationship with them by being compassionate adults, they might not come back to us for help, right? Or they might not see us as a reliable person in their life who's going to actually help them create the changes that they want to create. So we're going to do whatever we can as an adult to be compassionate towards them and whatever their reality is and whatever their choices are, to let them know that we trust them and that we are here to support them in the relationships or in the changes that they're trying to make. So that kind of things. So that sort of encompasses the spirit that we're kind of, as adults, we're coming to with this MI practice. So if we are working with them in a clinical setting, right, we want to be thinking about, okay, how are we going to bring a collaborative spirit to the setting, which may or may not always be present in traditional clinical settings. So how can we bring that with us when we're talking with young people? How can we continue to recognize that they are autonomous? How can we continue to be providers who are accepting of where they're at and building trust by being compassionate adults for them? So that's sort of the spirit that we come to when we're having these conversations of motivational interviewing with young people. Whether we have 5 minutes, whether we have half an hour, this is sort of the spirit that we're trying to bring with us when we have these conversations, to help them feel like, yeah, I can do this, right? I know what I want to do. I'm going to figure out how to get there. This adult is helping me do that, helping me be the best young person that I can be. So that is sort of the spirit that we're coming with that.
Awesome. Thanks, Caitlin. So the next piece that we're going to talk about is really the skills and the communication styles in MI. And so it's really helpful for Caitlin to have just gone through kind of the spirit of this, because again, what we do with the spirit is, what is the feeling here? What do we want this young person to experience and feel? Then we as the practitioners have lots to do in terms of the skills that we need to provide and the way that we want to do this. But it's really important to remember, again, that sort of the spirit of it is collaborative, it's open, it's accepting, it's non-judgmental. So as we think about how we're going to do all that, there are lots of things on the screen in front of you here that tell you a little bit more about the kind of things that we do in MI that kind of attend to the language of change. So the first one, and I'm going to go through all of these separately, but I'll talk about them here kind of as an overarching thing. So open-ended questions are going to, of course, draw out and explore a person's experiences, perspectives, and ideas. Affirmations really are of strengths and efforts and past successes to help build their hope and their confidence in trying to change. Affirmations are bigger than just a compliment. They're kind of deeper, and we'll talk about that. Reflective listening is really based on kind of careful listening and trying to understand what a person is saying. It is usually characterized by repeating, rephrasing, or kind of offering a deeper guess about what the person is trying to say. And it really is a guess. If you get it wrong, it's all right, because that's an opportunity for the young person to tell you, actually, no, this is what I was hoping that you would talk about, or actually what I was trying to say is this. Summarizing is a really important part of motivational interviewing. It's probably the thing that actually I think gets skipped the most or left out the most, but summarizing really ensures shared understanding and reinforces key points that are made by our clients. It also really shows that we're listening when we can summarize really nicely what they've been saying and kind of use that to tie up any loose ends and then transition onto a new topic. attending to the language of change and the exchange of information are kind of the last two things that are part of this. So informing and advising really is just, respecting that both the clinician and the client have expertise and that sharing information is a two-way street. And then attending to the language of change is, and we're going to talk a little bit more about what we want to hear from our young people when they're in the settings with us. So what we're hoping that they will say is things called change talk, which is things that they might say in favor of, yeah, I think I might be able to try doing that or start doing that thing, rather than the kind of thing that we might anticipate, which is sustained talk, or the kind of things that people, kind of excuses folks give for like, I don't think I can do that, or that's really too hard, or I'm not ready to yet. And so all of these things are skills that we are going to ask you to be using in motivational interviewing. So I want to go through each of these with a little bit more detail so you have a good sense of how you might use this in your work with young folks. So when you think about open-ended questions, so first of all, if you mess up and you ask a closed-ended question, don't worry, we all do it. I do it all the time. And then I go to myself, whoops, that was a closed-ended question. And I say, can you tell me more about that? Or thanks for letting me know that you said no to that. Can you say more, right? And so I'll just ask for them to elaborate. But I think one of the hallmarks of people who do this quite well is the ability to ask open-ended questions and to ask questions that are not able to be answered with a yes, no, I don't know, I don't care, whatever. So you can see that there's questions on the screen here that are probably really common questions that you all ask in your work with youth. Things like, do you use condoms, or do you drink before you have sex, or do you talk with your partner about the risks of sex? Those kind of things absolutely might open up a conversation for a young person. They might just be an open book and tell you everything. Chances are good, though, that they're probably a little bit skeptical of you and what your agenda is and who you are, and that they might respond with, no, I don't know, sometimes. And so maybe a more helpful strategy might be to say something like, what kind of protection do you use when you have sex? Or for the second one down, or tell me about like substances that are part of the, conversation when you guys are having sex. Or what kind of conversations do you and your partner have about STDs or pregnancy or things like that? So you can just find simple little ways to kind of turn these things into open-ended questions, knowing too that, again, if you mess up and you say, do you talk with your partner? And they say, no, then you say, okay, so it sounds like communication maybe is not something that the two of you, or that you want to work on a little bit more. Talk to me a little bit about how you talk with your partner, right? So then you can always slip in an open-ended question. So even if you mess up and do it in a closed-ended way, all is not lost. It's pretty easy to kind of get back on track with this and move to an open-ended question. So affirmations, we were talking earlier about how these are bigger and more sort of deeper, I guess that you could say, than just a compliment, right? So the affirmations are self-esteem boosters, and they need to come from a genuine place. That's probably the most important thing I can stress here. So really the idea is you're highlighting the effort and not the outcomes, which I think is really, really critical. So you're highlighting the effort and not the outcomes in affirmation. So something short and sweet, like you followed through with the plan that you made for yourself, is a great affirmation to give to a young person. That's a great affirmation to give to anyone. What a great affirmation that would be if someone told you that. You can also search for positive characteristics that support change, point those things out, highlight those things, and make sure this young person knows, hey, that's a strength that you have. You see yourself as a resilient person. You are someone who values honesty in a relationship. You see so you can see here that, persistence, commitment, insight, organizing, being resourceful, being goal-oriented, being loyal, being a good observer. Any of those qualities that you notice in the young person sitting in front of you in that clinic on that day, point those things out. Really use those things to kind of give that young person a self-esteem boost to say, you do have the qualities that you need to make this change. We just need to figure out how to give you, maybe it's the confidence that you need, or maybe it's information that you need, but you have everything that you need to do this. We're just going to figure out how to tap into it. The next thing I want to make sure to talk about is reflections and reflective listening. So reflections are really important in motivational interviewing, and they are a guess. They're a big fat guess as to how the person is feeling and thinking at that time. But it is our opportunity to say, what I'm hearing you say is, and then we say what we think is going on for them. And again, it's their opportunity to say, yep, that's accurate. You've got it right. Or, actually that's not really it at all. So it's important to know that reflections are statements and not questions, and your voice should go down at the end so it doesn't sound like a question, all right? Some of us are great at this. Others of us really have to work hard at this. I am a work hard at this person. For some reason, just the tone of my voice and the way that I talk, that's just the way that it works, is just it just sounds like a question at the end. So I really have to work hard at this when I'm doing this kind of thing with a young person to make sure that my voice goes down at the end. And I don't say something like, so you're wondering if you asked your partner to use condoms, if they would freak out? Or you're wondering if you asked your partner to use condoms, if they would freak out. You can see just the very simple, just change in inflection in my voice, how that changes the statement and makes it not a question, but literally a statement. So there are plenty of kind of question starters here for you to get yourself going and use whatever feels authentic to you. Like everything in motivational interviewing, it should feel organic and right to you. So if it feels like you're trying to say something that doesn't feel like how you would normally say it, don't do it. I think that's, young people can see right through sort of like us trying and attempting and whatever. Like, be yourself, be natural, be real with young people. That is, I think, the most helpful strategy that you can have. So you're making a guess about what the person is meaning or feeling, but this allows us to provide more information and better understanding than questions, like reflections do. And it allows the patient to be more open to considering behavior change, because we're not making a judgment, we're just simply setting it out there for them to kind of listen to, hear, and either agree or not. So there are different kinds of reflections, as you can imagine. There are simple reflections, sort of more stabilizing reflections, where you literally repeat what the person has just said, or you maybe paraphrase it a slight bit. Most educators and people that work with young people and clinicians are pretty good at doing these simple reflections. What I heard you say is this, or so you think that you want to start using birth control, right? So you're just repeating what the person has said. Sometimes a simple reflection is exactly what you need. Like, you could use a simple reflection when you want to keep the conversation going as it is without guiding it. Like, they're kind of on a path where you feel like they're going to eventually arrive at the right conclusion. Using just a few important words or phrases that the other person used, or no inflection at the end, or just a statement, can actually be a great way for them to keep the conversation moving without inserting yourself into it. But complex reflections can sometimes be what you need, like sort of what's needed in that moment. So you would use complex when you want to avoid the conversation from going in circles, or you want to add meaning or take a guess about what the person's really trying to say, or you want to guide the conversation towards change. Like, you've noticed that they're saying some things that you think they might actually be ready to talk about this, think about this, learn more about this. So these are some examples of things that you could use to kind of move the conversation forward a little bit. So the first one is a double-sided reflection. I use this one all the time. This is probably my favorite one. This is using an and not a but to connect two sides of something to highlight a person's ambivalence. So this sounds complicated. It's not. Let me give you an example. So an example would be if someone tells you, I just got diagnosed with chlamydia last week and I don't want to get chlamydia again and I don't want to use condoms. So that's an example of a time where you would highlight somebody's ambivalence and almost highlight like two different outcomes that will happen based on what this person's sort of wanting for themselves, and just laying that out for them and letting them reflect on that. So saying something like, on one hand, you want to use condoms, but on the other hand, you don't even know how they'd feel or if they would even work. So really just acknowledging both sides of a person's ambivalence. That can be a really important way for a person to kind of consider the things that are holding them back from making a change. Paraphrasing is an example that some people are super great at. Other people sound silly, I guess, when they're paraphrasing. But usually paraphrasing is something like, I hear you saying, or it seems like, for example. So those kind of things for most of us feel okay to use. Metaphors, again, some people are great at metaphors, and metaphors roll off their tongue and they work perfectly. And then other people, it's like, you're trying really hard to think of a metaphor right now. And so again, know yourself, know what your style is and what makes sense to you. Some people do this beautifully and other people struggle. Like, leave it behind if it doesn't serve you. Don't worry about trying to come up with a metaphor. Like, if it doesn't fly, it doesn't fly. It's all good. An amplified reflection is one that I want to talk about, but also to kind of caution against a little bit. So an amplified reflection actually exaggerates the point so much that the person kind of has to disagree with you. And we'll talk a little bit about this when we talk about discord and resistance. So I'll kind of leave it there for now. But the important sort of caveat here is that this has a tendency it can make people feel patronized or mocked even, which of course is going to, ruin and kind of all of the goodwill that you're building here. So you have to know your young people really well to be able to use sort of an amplified reflection. All right. And so we talk about summarizing as really a way to ensure shared understanding and reinforce key points that are made by the young person, in your care at that point. So there's kind of different things that summaries can do for us. One is that they can kind of collect material that's been offered. So you can really just say, we've discussed this and this and this. And it's just a way to kind of bring everything back onto the table, especially in a clinical setting when you're like, we are kind of moving our way down the list of like things we need to talk about. You can go back and say, these are the things that we've discussed here. Or you can use it to link with something that was said earlier, right? So you can go back to something to say, I see that you just mentioned, barrier methods. We were talking about condoms earlier. Would it be useful right now if we talked about condoms as maybe a way to prevent STIs? The other thing you can do is draw together what's happened and transition to a new task or topic. That is what I like to do with summarizing. It's often you are finding yourself like, okay, I need to go to the next thing, but I'm not quite sure how to do it. A summary is a really great way to get you there. So to say something like, okay, so we've talked about X, Y, and Z. And I think this is a great opportunity to move on to talk about this next piece, which I feel like will be really helpful for you, whatever it is, right? So you really use it to kind of move on to the next thing. And it really shows, I think summarizing well really shows that you're listening. It shows that you're listening, that you're attentive to the conversation, that you're focused. And it can be a great way to kind of recap and kind of transition to the next piece. All right. So informing and advising, there is a role, of course, for you to play in terms of giving information and advice. But like everything with this, it's about timing. So young people might absolutely ask for advice, or they might ask, can you help me with that? Or I am trying to decide on this. Like, tell me about this, right? They might ask you to tell them something. But a very good rule of thumb for MI is to ask for permission before providing advice, a pamphlet, a handout, whatever it is. And it's as simple as just like, oh yeah, I'd be happy to share more about that. I have a pamphlet right here. Would that be okay if I shared that with you? It's useful to ask permission before offering advice and to offer a number of options to allow choice. And to let them know that it's their decision to act on the information. The autonomy to make the choice or to not make the choice is important in every scenario, but especially when we're working with youth. I wanted to talk a little bit about the ideas around sort of change talk and sustain talk. And when you hear these things, what you should do, because it's a green flag. It's the greenest of green flags for you as a practitioner to say, aha. Like it really is that aha moment of like, yes, they're saying things that's making me think that they might be sort of ready to think about doing this. So there are some things though to think about as we think about this. So motivational interviewing really accepts that ambivalence is a very normal human experience, and it's often a necessary step in the process of change. And it encourages clients to work with patients' ambivalence rather than viewing it as a problem, which is really, I think, sometimes different for the way some of us maybe were trained or were taught to think about this, is really to make ambivalence work for you. The clinician acts as a guide, clarifying the patient's strengths and aspirations, listening to their concerns, boosting their confidence, and eventually collaborating with them on a plan for change. And MI practitioners support people to resolve ambivalence at the same time as supporting positive change. And it's a delicate balance to do that. So there's a lot of comfort in the status quo, and there's a lot of reasons not to change. That said, when we think about what the language of change is, and we can hear it and listen for it, then we can really pick up on it and use it to move the conversation forward. So here's your picture of cute kittens for the day. And the reason why there's cute kittens is because this acronym is darn cat. None of these cats are darn cats. These are all cute cats. Mm-hmm. The acronym should really be cute cats. Anyway, it's darn cat. And the idea really is that if you see or you hear any of these kind of things coming from the mouth of your young person, you're like, ah, yes, okay, great. So they're talking about their desire, their ability, their reasons, their need to do something. They're talking about their commitment to do it and their activation and their taking steps. So if you're hearing any of these kinds of sentence starters from your young people, or any of these sort of verbs, if you will, like I can, I will, I would, I'm willing, I want to, that's good stuff. You want to grab onto that with everything you have and guide the conversation around this change talk that they are telling you about. So a few kind of ways to do that. I wanted to give you actually some examples rather than just to tell you. Here, you could elaborate. How do you elaborate? What do you do? So you could say something like, in what way? Tell me more. What else? Those are very easy and very simple, and for most people feel, I think, pretty organic. Like it doesn't feel really weird to say most of these. Although it can take a little bit of practice to get your head around, I think, some of the just ways of talking. It's just different when you're talking in a motivational interviewing setting versus in a more sort of traditional clinical setting. It can take a little practice to shift your language. So when we're affirming people, remember giving them, again, those deeper things that are beyond sort of compliments and they're sort of more attributes about themselves. Now that took a lot of courage. You're a person who can make changes when you really need to. Those are beautiful affirmations for a young person. So reflecting might look something like, that sounds like it's really important to you, or you realize this is becoming a problem. So you're really just hearing what they're saying. And those are both pretty simple reflections, especially the second one. Actually, they're both pretty simple reflections. There are obviously lots of complicated and complex reflections that a person could do, and they would be sort of situational, right? And then summarizing. So there are a number of things I'm hearing about your situation. So first, you're concerned about this, and also you feel this way, and also you're thinking this. So you can see here that it's really, you can take this and use this in whatever kind of way makes sense for you. But these are the ways, and you don't have to do all four. You could do one or two of these things, but really striving to do these things, any of these things. When you hear a young person giving you change talk, this is what you want to do in response to that. Like, tell me more. That's awesome. Like, let's think about what we want to do next. And then like really the summarizing. Awesome. Okay. We're going to talk next about the flow.
Yeah, awesome. Okay, so the flow of MI, so there's little arrows here, right? It could be that you go from engaging to focusing to evoking to planning, right? That could be one way that this goes. Or it could be that you go from engaging to focusing to evoking to focusing to planning to focusing to engaging, right? So they have these arrows going in one direction, but we might move them back and forth. And you are kind of decide, right, based on what you hear from the young person where you need to go. So engaging is the foundation, again, of this sort of process. We talked earlier about how you really need to develop a relationship that's built on trust and compassion, right? Where that young person feels like they're being heard and listened to and that they're in a safe space. Without that, they're not going to be able to open up to you and be honest and work with you to make the changes that they want to make. So engaging, number one, we can't start with planning. We can't start with evoking. We can't start with focusing. We got to start with engaging with that young person and creating a safe space with them so they can open up and be honest with you about what's going on. And I talked to all everybody already about that. So engaging, that's number one. Then from there, we can go to focusing, evoking, and planning. I will go to, the next slide. So engaging, again, we'll go through this a little bit more. What are the goals in the engaging process? We talked about this a little bit already, but establishing a trusting relationship, building rapport, making that person feel comfortable, making sure that they feel safe, and then obviously using our empathy to help those things out. What should you be thinking about when you are working on engaging? How comfortable is this person when they're talking to me? How supportive or helpful am I being to them? Do I understand their perspective and their concerns? And then also, how comfortable do I feel in this conversation? So Jill mentioned earlier, if it's not coming naturally to you, then don't do it, right? You don't want to feel like you're a robot in front of this young person. They're going to see right through you and they might be like, what's going on here? Are they trying too hard or, what's going on here? So stay in your comfort zone, but do also try to meet them, more than halfway, right? So you can create that safe space for them. Once you have that sort of rapport established with them, you feel like there's some flow there, you can start focusing on what is it that they are coming to you for, right? What's the problem that they want to resolve? What's the change that they want to make? And again, this is all about them, right? So what do they want? You might have a set of ideas in your own brain, but we're going to set those aside. So what are the goals in the focusing process? Exploring the behavior that they want to change, identifying the target behavior, exploring any feelings that they might have about feeling ambivalent about making that change. There's probably a lot. Or maybe not, who knows. And then exploring also the barriers that they might feel that are getting in the way of them creating that change. So some things to consider for yourself. What goals for change do they really have? Maybe they're saying one thing, but there's more that we can unravel from there. What's at the root of the change that they really want to make? Do I have different aspirations for them? Are we working together to create a common goal? Or are we moving in different directions, right? So again, trying to keep that young person at the focus of that's why they're here, right? And that's why you're here, to help them out. Where do they want to go? And you might have your own set of feelings about where you want them to go, but again, just focusing on where they're going, where do they want to go, what's important to them, and then do you have a clear sense of where they want to go so that you can work together on that. And you can always ask clarifying questions, right? It's a collaborative process. You're in this together. It's not just about you and it's not just about them. It's about both of you all working together. And then again, this word evoking. So the provider helps the patient identify the why behind their desire to change. So you're going to ask questions, you're going to stay non-judgmental, and normalize any ambivalence about making a change. So we're going to stay non-judgmental, right? We're going to create that engagement that we have with them, create that trusting relationship, maintain that, and then normalize any ambivalence, right? Maybe they're like the example that Jill mentioned earlier, I got chlamydia, but I don't like using condoms, but I don't want to get another STD, so I don't really know if I'm ready right, for this. I'm like, yeah, that makes sense. It's, sounds like you're experiencing difficult emotions with this, right? It's hard to make decisions about get all the things that we want. So in this evoking process, that's kind of where we're trying to start eliciting and reinforcing change talk. Hopefully we'll start to hear it in this process. So we're asking them questions about, okay, so why do you want to make this change, right? Why is this important to you? Is it more important to you to not get an STD, or is it more important to you to not use condoms, right? Getting curious about what's their motivation and developing their internal motivation, right? So recognizing, okay, yeah, you've had to make tough decisions in the past. You can make them again. I know that we've talked about this before and you're doing a great job. What things should I be mindful of when evoking? What are their own reasons for change? Is there any reluctance? Is that reluctance about confidence, or is it about how important that change is to them, right? So maybe they're like, actually, that's not really that important to me, or maybe they're just feeling like, I don't think that's even possible for me to do. And then you can kind of flesh that out. And then asking that question, am I hearing change talk? So that darn cat or those cute kittens, those are the things that we want to hear, right? Who doesn't want to hear a cute kitten? So thinking about that, are you hearing those things, or are you hearing maybe a lack of those things? And that gives you information that you need to figure out, okay, maybe we need to go back to creating a safe space for them, right? Or maybe we need to talk about giving some more affirmations. And then we'll talk about this in a little bit, but is the writing reflex pulling me to be the one arguing for change? So we'll talk about this in a moment, but the writing reflex can come from being an adult and being like, well, I know that I would do this, right? Or I think this is the best thing for you to do, and I don't hear you saying that, but I want to encourage you to do that even though it's not what you want to do, right? So that can be our own internal battle, but we got to make sure that this young person is at the forefront of what we're here to do, and we want to make sure that they're feeling autonomous and empowered. And then once we kind of start hearing that change talk, we can move into creating a plan. So when the patient feels ready, emphasis on the patient, the two of you can co-create a plan for how that change is going to happen. So this is when you've got an idea of, all right, we know there is a change that they want to create. How are we going to do that together? So how do you know when it's time to create a plan? And you may or may not get there in this conversation, but this is obviously one of the goals. We hope that we can help them sort of create a plan for how to create that change. So you know that it's time to create a plan when there is significant engagement and there is a clear shared change goal and there is sufficient patient motivation to change. So when you have all those three things going on, you can be like, all right, sounds like this person is on board, they know what they want to do, and they're really motivated to do it, right? They really want to do this. All right, let's figure it out. So the goals in the planning process are to develop their skills, to figure out how they're going to do this, to create an action plan, and to talk about what barriers might be in the way and how you can remove them or move around them. And then what support do they have right outside of this conversation? So who's going to be there for them? Do they need an accountability buddy? Do they have an accountability buddy, right? Who's in their network? What resources do they have to help them create this change? So that's sort of like the 4 processes help them sort of flesh this all out, and this is the flow, right? And like I said, you might move back and forth between these different things, but these are all great pieces of a conversation that you can have to help them really feel motivated, engaged, and supported in creating change in their life.
Excellent. So, I mean, even when we do things the way that Caitlin was describing with this beautiful flow and we're engaging with them and we have a plan, sometimes we experience discord or resistance. And so I wanted to talk to you a little bit about that as our kind of final section of our training today. We wanted to talk to you a little bit about resistance and discord because the sort of strategies to deal with this are just a little slightly bit different than dealing with a strategy that deal with a patient or a client who's completely, sort of, they're not resistant to anything you're saying and they're just sort of going with it. So Emma initially used the word resistance. So if you are seeing this word discord and thinking that I have not seen that before, that's different or that's unusual, and you're wondering where resistance went, it didn't go anywhere. It is still here. But I think that the Miller and Rolnick, I think, really felt like discord was actually a more helpful way to talk about what is really going on here. So resistance was initially used to describe disharmony between a client and a clinician as they explored change. But I think the idea was really that discord is like, we're not on the same wavelength. It's not like I'm resistant to doing this. Like, you're not hearing my reasons for change. You're not hearing my motivation or my non-motivation, right? Like if I'm not wanting to do something. So resistance or discord can be experienced during a session. And it's really important to recognize when this is happening and to step back and kind of assess the situation. We are going to talk a little bit about the writing reflex and like unsolicited advice in a minute. But one view of resistance is that can be that the client is behaving defiantly. I mean, like sometimes we get this feeling or this, that's sort of the wavelength that we get with this, is that they are defiant. They're not listening to what we have to say. And sometimes this requires that we change our perspective. Sometimes it requires that we, rather than saying this person's being defiant, maybe it's a signal for us to like change direction or just like listen more carefully. But it's basically the same idea. Resistance and discord are the same idea. The client's disagreeing with what you're saying and letting you know in different ways. And sometimes, when we experience discord, it typically means we need to back off. Because discord typically is the kind of thing that will fray or destroy or ruin all of the goodwill that you've been building in the session up to this point. When you press for change before someone's ready, it's the fastest way to make everything crumble. So when we think about the writing reflex, I had to keep this like GIF in here because I love it so much. Why are you booing me? I'm right. So in your mind, right, you're thinking, I know this is the right thing for this young person. This is going to keep them healthy. This is going to keep them safe. It is so frustrating that they're not listening to me. The urge to help by providing advice or information or solutions is probably the hardest part of this for most of us, because we are in this caring and helping profession because we have a deep desire to help and we care about people at our core. And this can be really hard to sort of let go of our own personal, opinions and preferences and pride and ego and defensiveness. There's all these things that come into play. And a really important thing that can be helpful at a stage where you're kind of coming up against a lot of discord and you're feeling that writing reflex within yourself is to kind of tell yourself something, to kind of just slow down and think about what's in your control and what isn't in your control. It can sometimes feel really tough to give up on the writing reflex and just sort of let it be. But that's exactly what we need to do in many occasions. Because our job is to focus on supporting the young person to resolve ambivalence by enabling them to voice their own reasons to change how and why they could do it. And if their autonomy is threatened even a little bit, they might start to resist. So there are a lot of ways that we can actually directly assure someone's autonomy, like it is your choice. It is totally your decision. Whatever you think is best. We can say those things. And again, if we are arguing or sort of threatening someone's autonomy even subtly, it's going to erode what we're trying to do. So we want to avoid arguing. We want to avoid kind of writing or correcting others. Certainly you can correct somebody if they have like factually wrong information and you're the clinician. Like it's okay to say, actually I have a little bit more information I'd love to share with you about that, because actually the thing that you said, there's a little bit of truth to it, but actually there's a little bit more I want to make sure that you know. So it's really important for us as folks who care a lot about young people to resist this writing reflex and really just to know that it's present and to take moments for ourselves to say, yep, that's what's happening here, and to kind of know it, kind of move through it and let it be. So shifting focus, if you've ever worked with teenagers, you know that shifting focus is often what you need to do in a moment to sort of go away from the thing that is causing angst or anxiety. So as it says here, goals are better achieved by simply not responding to the resistant statements or shifting topics. Oftentimes, diffusing discord by just, looking away from it and focusing on something else. So the example, script on the screen is for a young person saying like, what do you know about how I feel? Like, you don't know anything about my life, right? You probably never dealt with depression. And so, we've all heard things maybe like that or in that vein. And so you as a practitioner might say something like, yeah, it's hard to imagine how I could possibly understand. I wonder if we could just put that aside for now and talk about how things are going at school, right? If you know that you're just not getting anywhere and this young person's digging in their heels, shifting focus, and you could always return to it, right? You might have your sort of way of organizing your session with a patient, and you might make a little note of like, return to this. But sometimes it really is better to simply not respond to the resistant statement or shifting topics. So sometimes reframing, if it makes sense to do it, can be a really, really helpful way to deal with discord. So a good strategy to use when a patient denies a personal problem, or sort of when they are thinking like that's not something that I need to be worrying about, is kind of offering a new and positive interpretation of negative information provided by the client. So for example, if your patient reports like their older sister is like, you really need to spend less time on your phone. And your young person might be like, oh, my older sister's such a nag, or she's always telling me what to do. You could reframe this as, your older sister must care a lot about you to tell you something that she thinks is important for you, even though she knows that you're probably going to get mad, right? So it's inviting just them to examine their perceptions in a new light or sort of a reorganized form. So putting another frame around the client's story. So an example that I have in my notes is a client saying like, I've tried to quit vaping so many times and I can never do it. I always go back to it. And for you as a practitioner to say, you are really persistent, even in the face of discouragement. This change must be really important for you to make, right? So instead of going with the negative thing that they've said over and over and over, helping them see maybe a more positive frame or a more helpful framing or light to what they have been kind of maybe stuck with a little bit. We talked about emphasizing autonomy. There's a little bit more here on that for you. It's really, really important to avoid a power struggle with anyone, but especially with a young person, and putting it back on them to let them know that, yep, you're right. Nobody can make you do anything. I want to give you the right information so that you can make an informed decision for yourself, that truly that's what it's all about. A lot of times young people, again, when they perceive their autonomy as being threatened, that's the first thing that they'll do is say, actually, no, I don't want to do the thing because you're maybe suggesting that I do it, right? I'll show you. Nobody tells me what to do. These are very common things that lots of people, that's a very common reaction when someone is trying to kind of, move you in a place that you feel like your sense of choice is being threatened. And so really letting them know it's up to them. And early assurance of this kind can diminish resistance. So the example here is, if you have a young person, this is example, if you had a young person that was just like, I don't want to use condoms no matter what, like no matter what you tell me, you might say something like, yep, you know where to get them, you know how to use them, and you feel pretty comfortable talking about this with your partner. So it's your decision whether or not you use protection the next time you have sex. You're giving it all to them. You're telling them you have all the skills. You have everything that you need to be able to do this. It's your decision, right? The ball's in your court. Agreement with a twist is a really interesting one too. This is kind of similar to the last one in that it retains a sense of consonance with the patients while allowing you to continue to influence the direction of change. So it's basically like a slight twist or change of direction followed by a reframe. So it's a subtle strategy to agree with somebody, but then slightly disagree with maybe one part of it to kind of propel the discussion forward. So an example might be somebody who's like, I use condoms if I'm hooking up with somebody casually, but it's different when I'm with a person who I've been with before. And you might say something like, okay, so you protect yourself when you're having sex with somebody new. And when you're with somebody that you've had sex with before, you think maybe, they haven't given you an STD before, so maybe you're not so worried about it, right? So that's, an example of, you're saying, yeah, sounds like that makes sense to me, the thing that you said about using condoms with people that you're just meeting or that you are with someone new. And then you're kind of disagreeing with the second part about not using condoms with kind of a regular partner, and kind of throwing that out there and seeing what they come back with, right? So it's a reflection and it's followed by a reframe. And sometimes young people will be like, oh, yeah, you're right. I didn't think about it that way. Or I didn't realize that those two things were sort of almost at odds with each other. We talked a little bit about this one too, siding with the negative. And this is like, again, you have to be very genuine with this. If this is something that you're looking at this and right away you know that you just have the kind of countenance where this would come off wrong, don't do it. Some people just, and that's okay. A lot of times the motivational interviewing literature really talks about using this strategy with a client that you've known for a long time, or it's a session that's like a weekly thing with a young person. I am not totally sure that siding with the negative makes sense to use in a sort of a one-time clinical session, but your patients, your young people. If it's something that you think would work to make the conversation move forward, you could use it. So this is being sort of so extreme that they have to disagree with you. We've talked about vaping and you've made it clear that you don't see any negative aspects to this. Maybe you just aren't willing to change under any circumstances. And the goal would be for them to say, well, okay, like maybe if this happened, I'd be willing to change. So that you're getting them to say, 100% of the time you're saying you will not change. Is there a 5% of the time that you would do this, right? And it's being so extreme that they have to disagree with you. Again, know yourself. If you cannot be genuine, do not use this tactic. Another kind of caution in siding with the negative is to be cautious in using this too early in with depressed patients. You have to be very careful about using this with people who are going through kind of mental health stuff, especially depression, and feeling like there's not a whole lot of self-efficacy or self-esteem. Makes sense. All right, I wanted to share just a couple of quick strategies around group MI. I don't think it's probably the kind of thing that most folks listening to this webinar today will be partaking in, but there are sometimes opportunities to do things with maybe more than one young person, or to have, maybe you have a couple people that kind of want to hear what you have to say in the clinic that day, and you're doing something in a group. So there's a couple of just important things to know. When you're doing MI in a group, what you're essentially doing is what I call like a fishbowl style, where you are, even though you're in a group, you're kind of doing MI with one person and everybody else is kind of watching you and learning from the interaction, hearing things that you're saying and saying, oh, like I hadn't thought about that, or oh, I agree with that, or yes, I do that too. And so really the concept here, there's a acronym, because there's an acronym for everything, and this one is open. And so the group MI process here really is just, you're going to open with a group purpose to hear more about people's thoughts and concerns and choices. You are, of course, going to emphasize personal choice and autonomy. The environment, of course, has to be respectful and encouraging, and then it has to be non-confrontational. So there's ways to kind of do this where you would ask, more open-ended questions that are plural and more generalizing. So you could say something like, what do you all think, right? When you talk about, so you could explain something about maybe STIs or about drinking or vaping, and then say, what do y'all think of this information? Or you could say something like, I can tell people here really care about each other and are really supportive of one another. Or it sounds like the group is really interested in this. That's a simple reflection that if, you had 3 young people and they're all like, yeah, we want to talk about vaping. You're like, okay, great. Sounds like the group feels really interested in this. A double-sided reflection, and this is one that's coming from a curricula that Caitlin and I teach that's about drinking and about like kind of how those decisions about alcohol use come into play with sexual decision making. So somebody might say something like, you talked about the importance of fitting in and feeling good when you're out. And some people have said they're feeling concerned about how much they're drinking. So that's a double-sided reflection where you're laying out the ambivalence of the group on both sides of that and. And then the last one in a summary is, we've talked about feeling safe, having fun, and how difficult it sometimes can be to know how much we drink when we're hanging out with friends. So those are just some ways to kind of do this in a group setting if this is useful for you. And if it's not useful for you, no worries. All right. We wanted to share a few resources with you. These are really, really important. This isn't just a typical slide of like, here's just a bunch of stuff that's bullet pointed. I will actually draw your attention to the first bullet point in this list. Those of you that were part of our webinar series in June will remember that Dr. Jana Goritz-O'Brien shared that she has a couple of motivational interviewing documents that she goes back to over and over and over and over. The first thing on this list is that. And I wanted to make sure to share it with all of you because this is coming from a clinician who does adolescent behavior change using motivational interviewing. It is like exactly what you all need to take a look at to kind of do your work. So if this conversation has intrigued you and you want to learn more, that first thing on the list is probably the most important thing that's up there. So I would give that a look. A lot of what's here comes from Rolnick and Miller and has a lot of the things around, kind of these basic and, processes. But I will say Miller and Rolnick are continuing all the time to kind of update things. You can see they didn't just create this in the 80s and then, pieced out. They're still doing things in the field in the last, decade or so. And so I did also put in there's a free 1-hour online module for hospital doctors, nurses, healthcare professionals. So there are some free online tools that folks can use and utilize if they want to learn more and get more into this. That 1, 2, 3, 4, 5, fifth one down, the motivational interviewing ebook is also really helpful. It's about, I want to say maybe 30 or 40 pages. And it is like, if you read those pages, you would be able to do MI quite well. And it would require, of course, practice and all the things, but that's a really, really good resource. And so just wanted to make sure you had all of these things as you think about taking this and using this with the young people that you work with. We very much value your feedback about this presentation series, so we'd really like you to take a moment to just complete our short survey. You can access it by using the QR code there on your screen, and there's also a link for you to access the survey that way. Thank you all so much for hanging out with us here today at this webinar and learning more about motivational interviewing. Our contact information is there on the slide, and you can be in touch with us if you have any questions. Thank you. Bye. We would like to thank the Minnesota Department of Health's Child and Teen Checkup Program for the funding for this presentation.